HIPcast is brought to you by Enterprise Social Record, and today's episode is brought to you by Solarity. 80% of healthcare data is underutilized. Solarity is changing that. Our intelligent automation engine quickly and accurately identifies and analyzes all patient data, no matter its source or format. The result? Faster, more informed clinical decisions for physicians and better outcomes for patients. Solarity continues to revolutionize healthcare delivery, mitigate cost, and improve patient outcomes. Identify, validate, and abstract data from any source with Solarity. Visit them at solarityhealth.com to learn more.
Well, today we have Lisa Chapdelaine with us, and this is my first time meeting Lisa. Seth, how about you? Is this your first time meeting her?
First time, so a lot of accents on this call.
She's got a wonderful accent. I cannot wait for you all to hear it. It's just so in contrast with mine and Seth. So I'm going to read Lisa's bio for the listeners so they'll know who she is as well. Lisa Chapdelaine started as a records clerk at St. Vincent's Hospital 18 years ago. Her supervisor and department director encouraged her to go to school. Lisa got her bachelor's degree in science, HIM, and earned her RHIA. She worked for the Department of Mental Health for 3 years before she was hired as the Director of Medical Records, HIM, for a community-based program. She's now the Director of Communications for Mahima, past president of Mahima, Team Excellence Award. Past recipient of the Team Excellence Award, and is enrolled in SNU, working on master's degree, and is studying for the HIPcast exam. So congratulations, by the way, on working on your master's.
Thank you.
It's always a fun process.
A lot of hard work, but it's a little adjustment to get used to going back to school at such a late age. But I did it with a lot of encouragement from my family, and they never see me anymore.
Yeah, Seth and I have done that as well. We definitely understand the kind of the sacrifice that everybody there has to make. And I'm interested, like some of the things we're going to talk about today are kind of what's happening in duplicate records and in your health. If in your healthcare organization, and we'll talk about the future. And I'm very interested to think about what your future holds in terms of not only education, but where you see yourself going. So welcome to the show. It's so nice to meet you.
Nice to meet you too.
And so we got a little bit of your bio, but we have a lot of students that listen to this, a lot of schools that encourage their students to listen to our podcast. And what we like to do is just highlight HI professionals and their careers and what their journey has been over the course of time. I think a lot of students come into the profession going, I'm going to be the CEO of the hospital when I graduate from HIM school. And they quickly realize, no, it's a journey.
Not that easy.
It's not that easy. So tell us about your journey. How did you start, and how did you end up where you are today?
I started, like I said, my director at the time, I started as a temp clerk at St. Vincent. And a funny story is that my grandmother held the same job that I ended up getting.
Oh, that's fun.
And a lot of my coworkers were familiar with my grandmother. So they were like, because they looked at me and they're like, we know you from somewhere. And I'm like, no, you don't. And then they found out what my maiden name was. And they're like, oh my God, you're her granddaughter. And they're like, oh heck, we're in trouble. But my supervisor at the time thought I had a knack, and she talked to the director of the department, and they encouraged me to go back to school along with my family. And my family has also they created this monster, so they have to live with it now. They helped to create it. But I went back to school. It took some time because my kids were still in school. So I went to school at night. It took a little longer. I graduated. My kids were at my graduation, and they loved it. And they were just so excited. They're like, my mom just graduated college and got her bachelor's degree. And they were so excited to go back and tell their friends that, even though you're a parent, your parent is older, it's okay for them to go back to school. It's okay for them to continue their education. And a lot of their friends found it awesome. So when I was absent from different school functions, they knew I was home doing homework.
Yeah.
So, but they encouraged me. I went back. I sat for my credentials, got them right after I had received a job from the state, which was a step up from where I was at St. Vincent. And it's just been going forward. I got a offer for the present job that I'm in. And I thought I was done. And then I went to conference this past year in October. And I said, I'd really like to get my fellow. And I went home. I was talking with my family about it. Then they were like, why don't you go back to school? And I said, you sure? Because, it's going to take up a lot of my time. And I'm studying for my chips at the same time. And they were like, yeah, go ahead. Yeah, well, guess what? Mom's not available anymore.
Yeah.
I love the inspiration that you were for your kids. Same for me. And then of course Seth just finished his doctorate a couple of years ago too. Has it been 2 years now, Seth?
It is. Yeah, that was my COVID activity. I earned it in the parking lot of my daughter's gymnastics gym.
Yeah. So all three of us have children who have, been in our life already when we've had at least one college graduation. And I think that's awesome. It's very inspiring. I'm curious though, on your journey, how did you end up finding the role for the medical records clerk that led you into the hospital to start with? Was it a newspaper? Did you answer a newspaper?
No,
How'd that work?
Yeah, no, I applied through, I put my name in with a temp agency. And with the history that I have of customer service, they said, okay, why don't we try this and see how it works out? And it worked out fantastic. I worked there for quite a few years before I finished. I actually went to the state. So, with the great thing too was my kids helped me study. So they know everything. But I started at St. Vincent's. I think I was there for a good 11 or 12 years before I moved on. And I only moved on because there was only a lateral position, and not even that was gonna increase where I could go, what I could do. So I said, you know what, I'm gonna start looking for something else. And I was hired as a supervisor for DMH, a DMH facility here in the area. I worked there for 3 years, building up my supervisory skills. I still have a lot of skills that I need to get under control.
Don't we all?
Oh, yeah.
Me, go ahead. I got my toes stepped on already.
Oh, yeah. Yes. So when I was offered this job, I jumped at it because I'm like, this is awesome, because it's like a huge jump from where I was. And I came into the company and was that literally, here you go. We need you to clean this up, please. And I went, okay. And I didn't bat an eye. I hit the ground running, and we were able to move our warehouse from the 4th floor of a building. And everybody knows you don't put paper on the 4th floor.
No, that's a fun fact for folks. Medical records is always on the ground floor because of the weight.
Right. And when I saw the warehouse, I couldn't believe it. I was like, are you people crazy? It's on the
Especially
floor.
the ones below you.
Yeah.
It's on
Who else at risk? Patients, staff, everyone.
Oh, yeah. Well, the building was underutilized at the time that I had to move the records. But it did cause a lot of problems because it was weighing a lot on the floor. We were able to move it to the ground floor, along with getting rid of records from the 70s and 60s that were still here.
Wow.
And the clients were not being seen. So there was a lot of destruction, shredding. It took 6 months to get it ready to move. Actually, it didn't even, it, from the time that I started to the time it was finished, it was like 6 months, but it was a last minute, we're moving you because we need that space. So I arranged for everything. I got the shredding team on site. I actually changed the shredding team because it was more cost effective before I started that project, and brought them in. They were here for about a week along with the movers, and we moved everything from the 4th floor to the ground floor where it was safer, and cleaned out a lot of records at the same time.
That's
I
awesome.
love that.
That's it.
It reminds me, I did that one time. We weren't in the ground floor, but I remember the hospital CFO came to me and he was like, "Hey, you're in revenue producing space in the hospital. We need this record room moved." And I thought, okay, what am I supposed to do from there? You know, a lot of times on this podcast, Shannon, we talk about technology and AI. Sometimes you've got to move paper records. Sometimes you've got to move a department, and it's a challenge. It is a tough project.
It is.
The big thing that I'll mention that I love what you said there is when they came to you and said, "Would you do this?" You said yes.
Yep.
That's a growth opportunity for young professionals. Say yes.
Yep.
Because then you learn how to do the shredding process, how to do the move. You learn how to project manage over the course of time, and that's so invaluable
and I'm
for young
still
professionals.
project managing because we have to move again.
Oh,
This is so interesting. I had a call earlier this week with a hospital CFO in Atlanta. And one of the things that they are looking at is we have a massive storage room of paper that we need to go through because a lot of those records are well past the age of destruction.
Yeah.
And for anybody listening that may be not a health information professional or maybe doesn't know this yet, you can't just destroy the boxes that have been there for 10 years or for 20 or for 1 year past the age of majority or whatever your state law says, right? You can't just look at the box and say, okay, this is out. You got to check for legal holds and you've got to check. There are a million things that you have to do. You have to index this stuff. So it's not like you can just take the whole thing to the shredder. You have to process this. So it is an easy thing. So, and it's so funny. 2011 is when we started meaningful use of electronic medical records. It's been 14 years and we're still talking about paper destruction.
Yeah.
And not talking about it as if these plans for destruction have been rolling and everything is going away and we're decreasing the amount of paper. Just like, what the heck are we going to do with this mess? Which actually brings me to the one of the things I want to talk to you about today. So I want to talk about duplicate records, duplicate accounts. Here's something very interesting about this conversation. When we had paper records, what do you think the percentage of times in the course of a year that we had duplicate records created in terminal digit filing? Like 0.00001% or something, right? We have created this new problem with duplicate records. So yeah, it's a monster. So tell me what's happening, because Seth and I, neither one are in a hospital setting at this point. So what's happening with how you create? What's the process? How is it broken? How are so many records getting duplicate numbers? What's happening?
A lot of times staff don't know how to use the demographics. I've done education with staff members. I've given them 5 key identifiers to use, and it's up to them to use those identifiers, whether they use them or not. Sometimes when we get clients come in, they use it, they have an alias, or they don't remember when they were here last, or they've been married, they're married now and their name had changed. And the admitting staff or the call center staff don't dig deep enough to find those original records. And with that being said, we end up with a lot of duplicate charts. In this setting here, because we're community based, we have a lot of programs. Sometimes staff rush. They rush through the registration process. Sometimes we can catch them within 24 hours and sometimes we can't. Sometimes I find a record that they've been charting in both records.
Oh, wow.
And sometimes I find records that they've been documenting in for the last 6 months, but the patient has an original chart and we have to move all their stuff to that active number because otherwise it'll screw up the billing. If they're admitted, if they're discharged, I can move it to the original chart. But if we can't move it to the original chart and we have to move it to the other one, it's with the system we presently have, there is a lot of work. You have to print everything out manually, scan it manually, and then drop it into the correct chart because our system at the moment can't handle just moving it and doing a dump. It has to be done all manually, which I have been working on this since we settled into our new offices right after I did the warehouse. I got my
one
staff,
problem to the next.
Yes, my staff was working on. There was no one in my position for quite some time, so there was no leadership and paperwork built up. Because of that, a lot of the current medications, notes may not have been in those patient charts, the current patient charts. So our first task was to get all that paper that should have been in the electronic record into the electronic record. So we've cleaned that up. It is gone. And it was like 2 to 3 years worth of stuff that just sat in boxes, piled up. So staff took it. I assigned them. I said, in between your regular work, this is what I'd like you to do. They have finished it as of 3 weeks ago. Yes.
Man, I can see so many downstream negative impacts here. So if you're printing from one record to put into another, you're printing it, scanning it in.
Yes.
It's not populating metadata fields for you to get a longitudinal view of that patient's X, whatever you're looking at, right? Like it's not populating vital signs and whatever the things are. Man, like this is blowing my mind a little bit because if you think about, you mentioned having a lot of programs and sometimes it's almost like, it sounds like your programs potentially have multiple points of entry to register your program.
Well, we've streamlined that since it's been streamlined. There are 2 call centers. So the calls go into the call center and the call center sets up the appointments. The other thing we have is called a mobile crisis team, and they service. It's not just not one program. It's several programs under that same umbrella. And sometimes we get adolescents that that our caseworkers need to go out to hospitals for. So they have to do their own point of entry, if I'm not mistaken. I'm not quite sure how it works on their end, but sometimes the caseworkers have to do the point of entry. And sometimes those things get a little messy because they're trying to de-escalate a patient and get information from them at the same time.
Healthcare is hard. That's what I'm hearing. Healthcare is hard, and it's even more difficult when you tag in a demographic of healthcare that it gets really complicated when you have multiple entry points. You have different things going on. It's a challenge.
And the double charts, the double numbers, they irk me because I still have it. My father is elderly. My mother passed away a few years ago, but they had mixed up things in their charts. And that irks me. And I went to Washington last year to advocate for the Match It Act. And I heard it's being reinstated this year. That's good.
Yeah, they'll be talking about it next week. I think, is it next week when they're there?
I think so. So it bothers me. And when people kind of fluff it off, I bring it up to them. What would you do if it was your family member? How would you feel? if you knew there was 2 charts with your loved one's information in it, and the hospital is, or whatever facility they're in, is not treating them correctly because they don't have all the information.
Mhm.
And my mother had a lot of allergies to medications, and they didn't have all that information at one time. So anytime any of these things come up, I just point blank, how would you feel if it was your loved one, your child, your parent that was in this situation, and their information wasn't all in the same place and they weren't being treated correctly? How do you feel? And they're like, well, I'd be pissed. And exactly.
Mhm.
Can you bleep that out, Seth? Can you edit that word?
That's the
They would be very angry
Massachusetts.
if we were in the same situation. And they would be advocating for themselves. But
Yeah.
if I can advocate for those clients on this side and make sure all the information is in the correct place when it's needed, I've actually had to explain that to leadership at different times. How would you feel? You're a
Mhm.
doctor. How do you feel going looking for that information and you can't find it? There's a gap in that patient's care because they documented 2 years in another chart, and then they went back to the original chart, and you're missing that 2-year gap. But
And
you
that's
know that they were here.
significant impact.
Exactly. And it causes problems for the patient, the billing, the revenue, everything. It comes into play at some point in time that it affects everything that goes on with a client or a patient.
Yeah. Well, yeah. Think about new diagnoses,
Mm-hmm.
new treatments, and new medications that have
Right.
been prescribed here.
Right.
But then you revert to that, the next time they come in, you revert somehow to that older original record and you start documenting there. You're missing all that new information. And it doesn't even matter if you've reconciled those in the process that you're talking about because you're scanning and then uploading into this other record, but that medication reconciliation is never happening.
Right.
And until there's another acute situation where you're like, hey, this person's actually on all these meds, right? But there's no fluid reconciliation of medication. That has so many impacts. Contraindication, poor performance because they're not following the protocol of the things that they need today.
Mm-hmm.
I mean, a million things can go wrong there.
Exactly.
And it's 2025.
No.
Yeah, that's the crazy thing is we're still talking about it.
Yes.
And you saying St. Vincent's makes me think of my first hospital was St. Mary's. Good old Catholic hospitals. I loved them.
Yeah.
One of the sisters would always bring me a popsicle down to the emergency department. My first job, I used to love when Sister Mary Stella would come down and bring me a popsicle. But we've talked a lot about kind of the journey and some of the challenges that are going on today. But what's the future look like for Lisa and for the HI profession for Lisa?
I see us with AI now. A lot of cybersecurity issues. Our organization was involved in that change.org. We were involved with that, and it impacted us a lot. And since then, I've been looking into cybersecurity. And when I go to conference, I go to the cybersecurity speaking sessions,
track. Yep.
And it has sparked another interest. So I went home one day and I said, guess what? That monster you created has decided to go on to cybersecurity after she gets her master's degree.
Wow.
And they laugh at me and they're like, what are you talking about? I said, it's very simple. Everything is electronic. Everything can be breached. And the more people that we have that can keep us from being breached, the better. And that's my next step. I want to get into the cybersecurity. I want to understand it better. I've already got a little bit of a grasp on it. I've been taking a side course in cybersecurity, and I I want to be able to be a gatekeeper, so to speak, for the electronic records and for the access to those records. And I want to be able to prevent these breaches from happening if I can.
Well, you really already are a gatekeeper as the health information professional. You're just not a cyber gatekeeper, right?
Yes.
But I love that idea and I love the interest that you have in that. And it just makes me think about if we're governing as much as we do now, does it make sense to add some cyber education to our existing curriculum? I mean, I think that's so smart. I love that you're interested. I'm not interested in that education at all, but I love that you are. but it does make sense that we need to be, and maybe it is in our curriculum now. I don't know. I'm not sure. You'll find out if it's in the master's curriculum pretty soon.
Actually started throwing some cybersecurity stuff at us and finding it very, very interesting. And I just, like I said, if I can advocate for the patients and the clients and I can protect their records, that's what I want to do. And in this position right now, I am by doing my job, but I want to expand on that. Don't tell my husband I'm already taking that class. They don't know. They don't know because I already have I'm already carrying 2 classes for my master's. I'm doing my chips, studying for my chips. And then I signed up for a free class on cybersecurity. So
I love it. I think it's great.
Yeah. So I never come out of my home office. My husband peeks his head in the door and he says, do you want to take a break right now? You've been up here for a few hours. Or he'll hand some food in the door to me, or he'll send the dogs up to get me. And, if the dogs punch in my door at home, I know it's time to take a break because somebody sent them up the stairs.
Yeah. Well, I mean, it just screams the fact that the health information profession allows you to go in so many different directions. Because I'm with you. I love cybersecurity. I love digging into it and trying to figure out what's going on. What are the threats? What's happening in different places? One of the big things that at HIMSS a couple of weeks ago was the theme of resiliency. Health systems and providers are trying to figure out, how do we build a resilient IT practice and health information practice to withstand the threats? But what do we do when we go down?
It's hard.
Can we go back to paper?
Right. It's hard, and we need those trained people to protect that so that we don't get these cyber attacks anymore. We don't get held hostage by the black hats that want X amount of dollars before they'll release any information.
Well, before you get too deep into it, I'll tell you, it's very scary. It's very scary how much of just everything is very vulnerable to these attacks, from the healthcare side of the world to the utility side of the world for
airlines.
Water and I mean, it will scare you to death if you dig too deep.
You'll
start prepping.
I'm going to keep my head in the sand over here.
Yeah, no, I wanted to do that, and then I went, no, you have to, if you can be proactive, you need to do something about it.
Yeah, I think that's great.
Yeah, I think that's really interesting. Seth, you said something that I think is really important too. You said our profession touches so many different streams. I was having a conversation with my business partner this morning about, even with marketing your products to healthcare, you just can't market to the group that you think you're solving a problem for because of the interdependencies. Like if you think about, Seth, you're a global sales rep for print and fax services, right? I get that right?
Sure.
You can't, I don't even know. You just get to go to all these really cool places. I'm a little jealous of that, but and the company pays you to do it and they pay for you to travel.
I need a job like that.
Yeah, I know, it's really fun. But it's interesting that when you go in, you're looking at the needs of that organization. And you're not just talking to one group, right? Aren't you talking to multiple stakeholders?
That's what
IT plus business, right?
That's what I teach my sales teams on. If you're talking to one person, you're in trouble. You need to don't assume that the right hand is talking to the left hand and the left hand's talking to the right foot. You need to bring all parties involved and say, look, this is what we're trying to solve, and this is how we can do it. But I need input from all of you to make an informed decision. And that's the encouragement, because just from the theme that we've had, healthcare is hard. Healthcare is complicated, and you got to have everybody involved and everybody rowing at the same time to keep this thing moving.
Yeah. Well, Lisa, thank you for joining us today. Oh, wow. Your light just got brighter. What you look like. I love it.
Dark, and I just touched the camera and it got bright.
Okay. That's hilarious. But thank you for coming. It's great to meet you. I absolutely love your accent. Your accent is a wonderful thing. And it's really cool, the journey that you're on. I love how inspiring you are to people to say immediately, hey, it's not too late. And also my kids got to watch me graduate, and they'll get to watch you graduate again. And now they have a different perspective of it because they're older. And then, we won't tell your husband yet, but when you go back for cybersecurity, they'll be even older and they'll have a lot more, understanding of what you're kind of facing and what the challenges are.
The same thing goes with my grandchildren. They, believe it or not, I have 3. When they heard that I was going back to school, they were like, why is Mama going back to school? Why does she want to go back to school? She's not a kid, because they see it as they're younger. They're way younger. And we sat them down one day, especially the 4-year-old. She was so funny. She goes, Mama, why? I said, because there's a need for what I do to be done in a certain way. And if I can be part of that, I want to be part of that. That's awesome. They think now, now that they have a little grasp on it, they think it's so cool. They brag to their friends, my mama's in school. And it's so funny, because when I go there for birthday parties and stuff, they're like, that's your mama, the one that's in school? And I'm like, oh my God.
That's awesome. I love that you're, the way you were describing it is, because we need people to do this kind of thing that I do. And if I could be part of that, then I want to be part of that. It's so inspiring.
We are a dying breed, unfortunately. We need to get the younger generation involved and get them to realize that this is not an fading away job. This is a job that is here to stay, and to handle these records, because a lot of times you get some people that just aren't trained correctly or understand best practices or some of the regulations and standards that we have to go by. And like I said, it's a dying breed. I see less and less students taking these classes.
Yeah,
you're
it's
right.
true.
There's a huge future for us if we can just recruit them. But Lisa, I'd say you're an inspiration. Thank you for joining us here on HIPcast. We've really enjoyed the conversation. And Shannan, until next time, my friend.
See you next time, buddy.